So when you attend meetings such as the American Heart Association here, we hear about all sorts of wonderful studies that are being introduced, game-changing therapies. We just had the introduction of the new ACC-AHA cholesterol guidelines. And one of the things that we always think of as physicians is that we're early adopters of all of this information. And in fact, when one does the health services research, one finds that there is always a disconcerting lag in terms of the time innovations and these findings to be taken up and applied. So as cardiologists, what is happening is we're becoming increasingly specialized and subspecialized. We're no longer, like me, a general cardiologist. I have my colleagues who are not only interventionalists, but they're further specializing in TAVI, chronic total occlusion, and so forth. We can do that because we're specialists in a particular organ. The primary care physician or the general internist cannot hyper-specialize like that. They need to know a much broader set of conditions and manage those conditions. As importantly, what they have to be aware of are interactions, not only between certain disease states, but in terms of the therapies that are used to treat those sorts of disease states. And what a computer decision support tool could do, again, is to be working in the background to do the heavy lifting of digesting and feeding back to the primary care physician what some of those interactions might be based on the profile of the patient, what should be the priorities in terms of their management. And these are things that otherwise there's no way that the physicians would be able to keep up to date. Another interesting statistic is, this is in the field of epidemiology. I suspect it would be a lot more challenging in the field of medicine. But the current estimate is that an epidemiologist would have to spend 21 hours a day reading through the literature to stay abreast of what is current. And whatever is being published today, chances are within a couple of years it's going to be out of date. As I mentioned, I think one of the important things about these tools is it allows for consistency of care. And when one does the health services research analyses of care in the community, what one sees is too much variation. There is too much time that is taken to adopt guidelines. And again, what we do is, this particular study focused on atrial fibrillation. Atrial fibrillation is a small part of what we do as cardiologists. We have to keep abreast of what's new in heart failure, what's new in ischemic heart disease, what is new in all sorts of other areas. Congenital heart disease, which is an area that is growing in medicine as we are becoming better and better at having our patients live longer.